Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi, and we have such an esteemed guest today on the podcast. In fact, pretty much everything that we talk about when we talk about healthcare guidelines in people with Down syndrome comes because of Dr. Bull and her team, who were the last set of guidelines, the biggest update I think that we had ever seen in guidelines in 2011 that have been since ratified a couple more times since then, but really came because of the work of Dr. Bull and her team. And so, Marilyn, I'm so glad to have you join us today on the podcast. For our listeners, would you mind telling us who you are, what you do, and why do you love working with people with Down syndrome?
Absolutely. And thank you for inviting me to talk about this important topic. So I'm a neurodevelopmental pediatrician. I'm a pediatrician from basically, and then I did special training in developmental pediatrics. I have been interested in Down syndrome and caring for children and their families with Down syndrome since my early days of training. And since in the last 30 years, I've directed the Down syndrome program at Indiana University, Riley Hospital for Children at Indiana University Health. So Down syndrome is absolutely one of my favorite things to participate in and to teach our residents and students. And so I'm very pleased to be able to be with you today.
That's wonderful. You've been doing this for so long. You've been doing it longer than I've been a pediatrician. So that's wonderful. That's wonderful. Well, I thought it would be a nice thing if you could just to walk us through. You know, a lot of our families, especially our newer families, will think that, oh, healthcare guidelines, that's been a part of Down syndrome care forever, but it really hasn't. And I wonder if you could give us a little bit of your recollection of how things were before and how we got to where we are today.
Absolutely. So it's been since the early 1970s, actually, that doctors have felt that organization of the guidelines for providing care for children with Down syndrome and other medical conditions are important. And so my work has been predominantly with the American Academy of Pediatrics, which is a group of 67,000 pediatricians from across the country. And we're organized into committees, councils, and sections with subspecialty interests. The guidance for Down syndrome, really some of the early work was published by the American Academy of Pediatrics and starting around 1984, and working with other groups like the Down syndrome medical interest groups. We published in 1999 the first really organized guidance for physicians and families in providing care for kids with Down syndrome. The next major revision of that guidance was in 2011, and that's the one that Dr. Vladi just referred to. And all guidance and policies at the American Academy of Pediatrics are looked at and reviewed every 3 years. So at that time, they're either retired by saying, well, we don't need this anymore, it's too old, or they're renewed and say, this is still current, this is what we need to do, or they're revised. So the Down syndrome guidance was reviewed every 3 years since 2011, and it was reaffirmed in 2014, and it was reaffirmed again in 2017, at which point it was determined that there were enough things that had evolved and changed that it was time for a revision. So they reaffirmed with an intent to revise, and at that point, a group of specialists in Down syndrome were solicited to participate as a committee, and I'm chairing that committee for this next revision. And that group developed a intent to revise that was approved by the board of directors of the American Academy of Pediatrics, and has worked on that document for about 2 years. At which point it was developed into a document and then sent to I think between 20 and 24 subspecialty groups at the Academy. That means everyone who's a specialist in heart problems, hearing problems, orthopedic problems, neurosurgery problems, all the areas that are of interest and importance to children with Down syndrome had an opportunity and were requested to please review and make sure that the information we're proposing to give is the most accurate and the most up to date. When that was done, they sent it back to our committee to incorporate those comments and suggestions, and that was completed. And the good news is that it has been sent back to the leadership in its final, we hope, form for approval by the board of directors and the leadership executive committee of the American Academy of Pediatrics. So when is that going to come out? The Academy's been very busy. COVID has caused them all sorts of problems and issues. Sure. So we don't know exactly, but we're really hopeful. They've had it for almost 3 months. So we're hoping to hear soon that there will be, I hope, the 2021 version of the healthcare guidance for care of children. And actually, we're going to say children and adolescents. The title, I think we expect the title to be changed because it will include, it always has included both groups, but just to designate that, that was one of the suggestions. We'll see. We'll see what the board of directors says.
That's so interesting. I mean, there's so many levels of revision, folks looking at this to make sure that the most accurate information is going out. And I think that's wonderful. I know that when the 2011 guidelines came out, one of the things that all of us who do this kind of work were impressed by was the amount of data that was looked at in order to come up with really evidence-based guidelines. And one area that I found probably caused the most amount of discussion, and I'd like to really see if we can focus our podcast on that a little bit now, is on Atlanto-axial instability, or AAI. And I guess before we get too far into it, could you give us an idea of what is Atlanto-axial instability? Why do we see it more commonly in people with Down syndrome?
Yes, and that's such an important issue, and one that we want all parents and providers to really understand how and what they should look for. So Atlanto-axial instability describes an increased movement between the top two vertebrae or bones in the neck. So you'll hear referred to as the cervical spine, the top bones of the neck. And this can be due to loose ligaments. It can be due to bony abnormalities or low tone that occurs in many persons with Down syndrome, or a combination of all of the above. And why this is important is that if there is that increased movement, the risk is that that can cause compression or pressure on the spinal cord. And that can cause damage to the spinal cord, causing nerve damage. And it occurs in several conditions, but more frequently, it does occur well recognized as a concurring condition in Down syndrome. So it's one thing that we really want to emphasize and talk about with our families.
Yeah, so I often think about it, and maybe, tell me if this makes sense to you too, but how flexible people with Down syndrome are, and, being able to bring their legs up over their head or touch their hands all the way down on the ground, their palms down there, and just that hyper flexibility because of the ligaments being able to stretch in that way. That same ligament that holds those cervical vertebrae bones together, those kinds of ligaments also can be moving too much. And in that situation, that's the concern, right? Because the spinal cord is right there. Does that seem conceptually to me? That's
perfect explanation. Exactly.
Okay, good. Because that would be really embarrassing if on the podcast you said that is totally wrong. So when somebody with Down syndrome has Atlanto-axial instability, like when it's a symptomatic issue, what are some of the things that families might see or doctors should be looking for to look for that?
So the things we want parents to be aware of and watch for is any change in how their child walks. If they suddenly drag a leg or appear weak, or maybe they just don't walk at all because they're weak, that can be a sign of pressure on the spinal cord causing a change in that area. It can also be a change in how they use their arms or hands. I had a preschool teacher who called mom and said, she used to be able to use scissors and now she can't use her hand, isn't working right, or something is wrong. And it was a weakness in her arm. So any change in how they use arms or hands, a change for children who are potty trained, a change in the bowel or bladder control, having unexplained accidents. Now, we know a lot of kids have accidents, but kids who are happening more frequently and it's just not explained, that could easily be another symptom that we watch for. And then neck pain. And that's a tricky one because we know so many of our children with Down syndrome have a very high threshold for pain. So they may not tell you my neck hurts, but they may bend their neck and hold it in a way that's turned so that they are actually protecting it and preventing it from hurting. Any tingling, although kids are not likely to describe that to us, they might say my hand burns, who knows? So those are the things that we watch for. Any new onset of weakness or decreased level in function. And I tell my parents, if they have concerns about that, they should run and not walk to the phone and call me, because we want to get the right evaluations done well and quickly.
And for the folks who are providers that listen to the podcast, what are some things that they should be looking for on exam if they're trying to do a complete and thorough exam for AAI in a child with Down syndrome?
Exactly. And that's one of the major recommendations from the American Academy of Pediatrics. And I should also say is one of the now requirements since 2015 of Special Olympics is that a thorough neurologic exam be done. So the recommendation is that providers do a thorough neurologic exam, specifically looking for changes in gait, looking for reflexes that have changed or are asymmetric. Those are the kinds of things that we would want providers to detect and be aware of. And similarly, I'm frequently asked, do I need to send this patient to you before to sign the Special Olympics forms? No, primary care providers should be able to do the neurologic exam and know and sign those Special Olympic forms. And maybe we should just say a little bit about x-rays, because in the past, the screening test prior to 2011 was recommended to be x-rays of the neck. And for many reasons, that is no longer recommended. It really is not an adequate screen. It's not an effective screen. It is not predictive of a normal exam being a child who a month later could easily manifest significant abnormality. So it's not a predictive or a qualify as a screening test and is not recommended. And what was frequently happening is not only was it excessive cost, excessive radiation, and we do monitor radiation for children, especially young children, in terms of cancer causing issues, and we don't want to x-ray them any more often than really is appropriate or necessary. And thirdly, I was seeing so many children where the x-rays were a little uncertain and they were not being allowed to participate in physical education at school or other normal sports activities, for which are really, really important for them to have as part of their lives. So it is not currently recommended as a screen, but it is the first test one does when you are suspicious or have reason to be concerned that there could be an atlanto-axial instability. And what we recommend then is a single lateral neck view. And if that's normal, then proceed to a flexion and extension views of the neck that would demonstrate if there was excessive movement. And then if that is of concern, sending that child to an orthopedist or a neurosurgeon who has experience in management of atlanto-axial instability.
And that was such a huge change, Marilyn. Thank you so much for bringing us through that. I mean, 2011 is 10 years ago now, and yet still families even to this day will say, oh, my PCP was wondering when I should order the neck x-ray, or and things like that. And so just to be totally clear for all of our listeners to this podcast, as of 2011, the recommendation had changed to no longer routine cervical spine x-rays for everybody with Down syndrome, which was a huge change. But as Dr. Bull just explained to us, it's because the x-ray was not a very great test to begin with. If you did not have any symptoms, it wasn't going to give you the answer that you needed. But when you have symptoms, that changes things statistically, and that's why it's still the first test to go to if you have symptoms. But asymptomatic, no x-ray needed. Did I summarize that well?
You absolutely summarized that perfectly. And I think it might be worth mentioning that we're talking predominantly about children, but the issues of atlanto-axial instability in adults also comes up. We don't honestly know how frequently that occurs. And the health first guidance for care of adults with Down syndrome was a very comprehensive look at 10 specific conditions, and they looked at atlanto-axial instability, and they determined, number one, there isn't really a lot of evidence because there hasn't been a lot of studies in adults, but also that the evidence that is present would substantiate the same recommendation to monitor a good neurologic exam and then evaluate should symptoms occur.
And for our listeners to know too, we all get together as folks who do this type of work. We get together once a year and talk about these types of topics. And a couple of years ago, we were all discussing, has anyone seen any higher chances or risks of atlanto-axial instability since the guideline had changed? And it was pretty clear, as long as we're doing good neurologic exams and taking good histories, really catching the issue the same and probably even better than just doing x-rays on everyone.
I think my phone would ring off the hook, and that has not occurred since 2011 because we just aren't seeing an increased risk.
That's wonderful.
And it's pretty rare anyway. I think that's important to know. It estimated that symptomatic atlanto-axial instability is about 1%, maybe 2% at the most of children with Down syndrome. So yes, it occurs. Yes, we should be aware of it, but it isn't a really high-risk entity either.
Wonderful. Well, I think we've really covered a lot of great information. Dr. Bull, are there other things that you think that we should cover that we didn't talk about yet?
No, I think for families of children, a good resource about this and other topics related to Down syndrome is at healthychildren.org. So this is the American Academy of Pediatrics website, and they can it's in English and Spanish. It toggles back and forth. And so it's a source where they can just look online, search Down syndrome, and they will find all this guidance regarding atlanto-axial instability there.
That's wonderful. In fact, the whole healthcare guideline translated into ways that are easy for families to understand are all found on that healthychildren.org, which is such a wonderful resource for families. So thank you for reminding, and I'll put that in our show notes as well for families to be able to click on it easily from this podcast. Well, thank you so much for sharing your expertise with us. It really is an honor to have you on the podcast with us today.
It was a wonderful pleasure. Thank you for all you do.
Yes, and families, if you have any questions or any topics that you would like us to discuss, please do reach out to us at Down Syndrome Center at chp.edu, and we would be glad to look for speakers to be able to come and share information with you as well. But until next time, bye-bye.